Nearly every day we're talking about the COVID-19 vaccine. The CDC, along with infectious disease experts and leaders at local hospitals, advise getting vaccinated is the best way to prevent severe symptoms and possible hospitalization from COVID. But there are strong opinions about the vaccine on both sides. So how do you discuss getting vaccinated with a friend or a family member without things turning into a fight? Good luck. Katie Jeffries is here to save the day. She has some pieces of advice from local psychologists.
One peek in the comments section on social media, and it's evident. People have some strong feelings about the COVID-19 vaccine. So we asked Baptist behavioral health psychologist Dr. Blazin Draculich the best ways to broach the heated topic. He gave us 5 pieces of advice. Number 1, understand from the onset that you may not be able to change their opinion and be okay with that. That should help you keep your emotions in check and help with number 2, which is don't lose your temper. Shouting matches are just not productive in discussions. Number 3, try to understand where the other person is coming from and let them give their side.
Letting that person know, hey, I'm here to listen to you. I'm here to hear you out.
Do your best to not interrupt them when they're speaking. Save the points you want to make for when they are finished. Number 4, do it in person. It can be hard, but resist the urge to get into online fights.
Commenting on posts can easily drag you into an argument because a person's tone is often lost in text and it can become combative. So keep the discussion to in person if possible.
And finally, number 5, know when to stop.
When you feel like those emotions are coming on, it is very important to say, hey, listen, we're not getting anywhere with this. It sounds like we're not hearing each other out. Let's take a break and come back and be able to discuss this again with your family member or with your friend.
And when it's all over, don't expect their opinion to have changed on the spot, but rather give them more credible information to help them make a decision.
So that was Katie Jeffries reporting there. We also asked him to cut through the misinformation if that is what your family member or your friend is basing their beliefs on. He says it's important to recognize what they're saying and don't necessarily try to fight their sources, but be ready with some credible data yourself, like a medical journal or from the CDC, to present to them as well. And remind them that you're having this discussion not to fight, but because you care about their health. Some very good advice there. Lauren?